Did you know that the number of people diagnosed with colon cancer before the age of 50 is steadily rising? This alarming trend has left doctors and researchers puzzled, while many individuals remain unaware of the silent danger growing within them. Colon cancer, the third most common cancer in the U.S., often shows no symptoms in its early stages. It's a sneaky disease, progressing quietly until it's harder to treat. But here's the good news. Recognizing subtle changes in your body can be a game changer. In today's video, we're uncovering 10 silent symptoms of colon cancer that you might be ignoring and sharing actionable steps to protect yourself. Your health is worth it, so stick around to learn more. Colon cancer ranks as the third most common cancer in the United States, affecting both men and women equally. With a lifetime risk of approximately 4%, it's a serious concern for millions. Yet, what makes this disease particularly dangerous is its silence. Colon cancer often develops without any obvious symptoms in its early stages. This silence can lull people into a false sense of security, delaying diagnosis until the disease has progressed. And while early-stage colon cancer is highly treatable, catching it before it advances is the real challenge. By the time symptoms become apparent, the cancer might already be harder to manage. This raises a crucial question. How do you recognize a threat that doesn't announce itself? The answer lies in understanding the subtle, often overlooked signs that your body might be sending. In this video, we're breaking down the 10 silent symptoms of colon cancer that you need to know. Awareness is the first step in protecting yourself, so don't miss out. This information could save your life or the life of someone you love. Let's dive into the symptoms and what you can do to stay one step ahead of this hidden threat. When it comes to colon cancer, timing is everything. Early detection can dramatically improve survival rates, with localized colon cancer having a 91% 5-year survival rate when caught in its initial stages. However, the chances of successful treatment decrease significantly as the cancer spreads to other parts of the body. The problem? Colon cancer often starts silently, with no obvious warning signs. It's easy to dismiss subtle symptoms or attribute them to less serious issues like stress, diet changes, or aging. Unfortunately, this delay in action can allow the cancer to progress unchecked. Recognizing these silent symptoms early could make all the difference. Even small, seemingly insignificant changes in your body might be your system's way of signaling that something isn't right. By staying alert to these signs and acting promptly, you give yourself the best chance of catching colon cancer early, when it's most treatable. 1. Abdominal pain or cramping. Persistent or unexplained abdominal pain can be an early warning sign of colon cancer. The pain might start as mild discomfort that's easy to dismiss but could intensify over time. Often it's misattributed to stress, dietary changes, or conditions like irritable bowel syndrome, IBS. Take Susan, a 35-year-old yoga instructor, for example. She was the epitome of health until she began experiencing occasional mild abdominal pain. At first, she shrugged it off as stress, but as the pain worsened, she noticed other symptoms like weight loss. Even then, doctors dismissed her concerns. By the time she insisted on a colonoscopy, a lemon-sized tumor was found, and the cancer had already spread. This story highlights the importance of listening to your body. If abdominal pain persists or worsens, don't ignore it. Seek medical advice promptly. 2. Changes in bowel habits. Changes in bowel habits, such as persistent diarrhea or constipation, are among the most common early signs of colon cancer. While temporary shifts can occur due to diet, travel, or stress, prolonged changes lasting more than 2 weeks may signal a problem. For example, if you suddenly experience frequent bouts of diarrhea or feel unusually constipated, it could mean that something is disrupting your colon's normal function. These changes occur because a tumor may partially block the bowel or irritate its lining, leading to abnormal activity. Many people dismiss these symptoms, thinking they'll resolve on their own. However, catching this sign early could be life-saving. If your bowel habits change and don't return to normal, it's time to consult a doctor to rule out serious underlying issues. 3. Narrow stools. Ribbon-like or unusually narrow stools are another symptom of colon cancer that is often overlooked. This change may occur when a tumor in the colon partially blocks the passage of stool, causing it to compress and become thinner. Because narrow stools can also result from other conditions like hemorrhoids or dietary issues, people often don't consider them a warning sign. However, if you notice this change persisting for more than a few days, it's worth taking seriously. Imagine noticing that your usual stool shape has changed, but thinking it's just temporary. This is how subtle colon cancer symptoms can be. Paying attention to these small changes and discussing them with your doctor can help catch the disease in its earliest and most treatable stages. 4. Blood and stool. Seeing blood in your stool can be alarming, but many dismiss it as harmless hemorrhoids. Colon cancer, however, can cause blood in the stool in two forms, visible or hidden. Bright red streaks on toilet paper or in the bowl may indicate bleeding in the lower colon or rectum. Hidden blood, which turns stool dark or black, can be detected only through medical tests. Take the story of Rob, a 40-year-old father who noticed occasional blood in his stool but chalked it up to hemorrhoids. When the bleeding became more frequent, he finally saw a doctor, only to discover he had early-stage colon cancer. The takeaway? Blood in your stool, visible or not, should never be ignored. Early testing can make all the difference in treatment outcomes. 5. Unexplained weight loss. Unintended weight loss may seem like a harmless or even welcome change, but it can be an early warning sign of colon cancer. Cancer cells alter your body's metabolism, leading to unintentional weight loss, even when your diet and activity levels remain the same. For example, if you suddenly drop 10 or more pounds without trying, it's worth investigating. The weight loss may also be accompanied by loss of appetite or fatigue. Such changes often fly under the radar, with people assuming stress or dietary habits are to blame. Don't ignore it. Sudden, unexplained weight loss could indicate that a tumor is interfering with your body's ability to absorb nutrients. 6. Fatigue and weakness. Persistent fatigue and weakness that won't go away, even with plenty of rest, may indicate colon cancer. This can result from internal bleeding caused by a tumor, which leads to anemia, a condition where your body doesn't have enough red blood cells to carry oxygen. Picture Sarah, a busy mom, who noticed she was feeling more tired than usual. Even after a full night's sleep, she struggled to get through her day. Assuming it was just stress, she ignored it until other symptoms appeared. Fatigue caused by colon cancer isn't the same as everyday tiredness. It's persistent and often severe. If you're feeling unusually weak or tired for no apparent reason, it's worth mentioning to your doctor. 7. Anemia, or a deficiency of red blood cells, is often a sign of internal bleeding in the colon. This can occur when a tumor causes slow, unnoticed blood loss over time. Symptoms of anemia include fatigue, weakness, shortness of breath, and pale skin. Many people with anemia may not initially suspect colon cancer, especially if they haven't noticed visible blood in their stool. However, a simple blood test can reveal whether your red blood cell levels are low. Doctors often use anemia as a clue to investigate further. If you're experiencing these symptoms, especially in combination with others on this list, it's essential to seek medical evaluation. 8. A feeling of incomplete bowel. Emptying. A constant feeling of needing to empty your bowels, even after just using the restroom, is a subtle but significant symptom of colon cancer. This sensation can occur when a tumor obstructs the bowel, creating the impression that something remains in the rectum. Many people dismiss this as a minor inconvenience or attribute it to digestive issues like IBS. However, if this feeling persists, it may signal something more serious. Imagine going about your day with a persistent urge to visit the restroom. This nagging symptom can disrupt your life while quietly pointing to an underlying problem. Paying attention to such changes and seeking medical advice early can help prevent late-stage diagnosis. 9. Nausea or vomiting. Persistent nausea or vomiting can be a symptom of colon cancer, particularly if a tumor is causing a partial bowel obstruction. This happens when the tumor blocks the normal passage of food, leading to digestive discomfort. While occasional nausea can result from various factors like food poisoning or stomach bugs, consistent or unexplained nausea should be taken seriously. For instance, John, a 50-year-old teacher, experienced ongoing nausea and occasional vomiting. He ignored it for months until he began losing weight. If nausea or vomiting becomes a regular occurrence without an obvious cause, it's time to consult your doctor. Tumors causing these symptoms are often advanced, making early detection even more critical. 10. Unexplained weight gain or bloating. Unexplained weight gain or bloating, especially in the midsection, is a less commonly discussed symptom of colon cancer. Tumors in the colon can cause blockages, leading to gas buildup and abdominal distension. For women, these symptoms are often mistaken for hormonal changes, such as bloating from menstruation or menopause. However, if the bloating is persistent and accompanied by other symptoms like changes in bowel habits, it could be a warning sign. Imagine dealing with months of bloating, only to discover it was caused by a growing tumor. The lesson here is clear. Don't dismiss chronic bloating or sudden weight changes. Listen to your body and get screened if these symptoms persist. Preventing colon cancer starts with lifestyle changes that can significantly lower your risk. A high-fiber diet rich in fruits, vegetables, and whole grains is key to maintaining a healthy colon. At the same time, reducing your intake of red and processed meats can help minimize cancer risks linked to diet. Regular physical activity is equally important. Not only does it boost overall health, but it also helps keep your digestive system functioning optimally. However, lifestyle changes alone aren't enough. Regular screening is crucial for early detection. The American Cancer Society now recommends that people at average risk begin colon cancer screening at age 45. If you have risk factors, such as a family history of colon cancer, you may need to start even earlier. The colonoscopy remains the gold standard for screening. This procedure not only detects cancer early, but can also prevent it by allowing doctors to remove polyps, small growths in the colon, before they turn cancerous. If the idea of a colonoscopy makes you hesitant, remember, it's a simple step that could save your life. Other screening methods exist, but nothing beats the effectiveness of a traditional colonoscopy in safeguarding your health. Don't delay. Talk to your doctor today. If you or someone you know has experienced any of these symptoms, don't wait. Talk to a doctor immediately. Early action can make all the difference in detecting and treating colon cancer. Have you or someone you know battled colon cancer? Share your story in the comments below. Your experience could help raise awareness and potentially save a life. If this video was helpful, hit that like button and subscribe to our channel for more health tips. It's a simple way to stay informed and empowered. Together, let's prioritize health and spread awareness. Colon cancer is serious, but knowledge and action are your most powerful tools. By staying informed, recognizing symptoms early, and taking preventive steps, you can protect your health and help raise awareness for others. Thank you for watching. If you found this video helpful, make sure to check out these other videos we've specially selected to keep you healthy and informed. Don't forget to subscribe for more valuable tips. Take care of yourself, and we'll see you in the next video.